Well, welcome back. I'm really excited for our next conversation. I am sitting here with Dr. Tom Mihaljevic, CEO of Cleveland Clinic. Thank you so much for being here.
Well, thank you very much for having me.
You know, I'm so excited about this conversation because you're leading such an incredible organization, one of the largest and most innovative global health systems in the world at such a pivotal time in our history of healthcare. So let's actually start right there with the scale, okay? So the scale of Cleveland Clinic. Can you give us a quick snapshot of Cleveland Clinic's mission, the work that you lead, and what the mission that you're driving?
Yes. So Cleveland Clinic is over 100 years old, and we were primarily based in Cleveland, Ohio. But over time, we have become a truly global provider of healthcare. So Cleveland Clinic employs 83,000 caregivers. We have 24 hospitals, more than 370 sites over 3 continents. We have a very strong presence in our home state of Ohio, but we also have domestic presence in Florida, in Nevada, international presence in Toronto, in the United Arab Emirates, in the United Kingdom, and affiliated presence and agreements with very many healthcare hospitals around the world.
That's incredible. And I'm not going to repeat all that back to you because it is large. So with something at that scale, what are some of the challenges that you face in delivering in your mission?
Yeah, the biggest challenge is really to have a reproducible excellence of care and experience for our patients at each site. Because when people come to Cleveland Clinic, regardless whether they enter Cleveland Clinic in London or Cleveland Clinic in Weston here in Florida or Cleveland Clinic in Cleveland, what they expect is a Cleveland Clinic quality of care. And that is truly the biggest challenge, the biggest opportunity. But what we can say is that when our patients seek care at Cleveland Clinic, we know that we can deliver uniform quality and uniform experience at all of our sites.
Well, that's incredible to be able to say with a scale like that. So, how do you see Oracle Health playing a role in helping to address that and help you deliver that kind of care?
Yeah, our partnership with Oracle Health is very, very, very exciting. What we are striving to do is to reimagine the way that we deliver care with the artificial intelligence and technology, computational technology at the very center of healthcare delivery. We believe that these tools that Oracle is developing will have a transformative effect on our ability to touch many more lives with Cleveland Clinic quality of care.
That's incredible. Well, we recently announced a partnership. And first, can you tell me a little bit about that and also why Oracle Health and why did you choose them to join that partnership?
Yeah, Oracle Health is an organization that is really, really focused on improvements in healthcare. And I think because of their scale, their capabilities, but also the similarities in our conviction as well as in our mission, we thought that there would be an ideal partner to do what I just mentioned, not to create just a solution for a discrete problem, but really to take on this ambitious goal of reinventing healthcare.
Yeah. And Oracle Health is good at taking on an ambitious goal.
Yes. So, no doubt about it.
So what are some things you have in motion already?
Well, what we are currently re-envisioning is the new environment for primary healthcare delivery.
Yes.
As you know, primary healthcare is something that every country in the world needs, and every country in the world struggles with access, struggles with quality in primary care, and struggles with affordability of healthcare in general.
Absolutely.
So this is really where we are starting our partnership, and is in reimagining the primary healthcare delivery.
Every place in the world does struggle with access.
Yes.
So that's incredible work to start putting in motion already. So how do you see this work impacting, the day-to-day work?
Well, first of all, we do believe that there is a phenomenal opportunity to create innovative, highly standardized environment for primary healthcare delivery.
Yes.
With an AI in the core, but also with the refined work processes based on Cleveland Clinic's experience, with a completely reimagined physical environment. And we believe that we will be able to create these new platforms for primary healthcare delivery that are going to be of global significance. So that's why our partnership with Oracle Health and G42, which is our parent company in the United Arab Emirates, where Cleveland Clinic in Abu Dhabi has a very, very strong presence, is so exciting.
So, you hear about the hospital of the future. Is that what you're talking about?
Yes, that is pretty much what we're talking about. Yes. The primary care of the future that will then lead in a hospital of the future. There's so much excitement around these new technological tools. There is so much excitement about these partnerships, in both of our organizations, Oracle Health Cleveland Clinic, as well as our partners at G42. So I'm very optimistic about what future will bring.
I'm optimistic as well. And so how will, and maybe when will, patients and providers experience this?
Well, the goal would be that patients have this unparalleled access to excellent primary care or the excellent healthcare in general. That providers start to embrace technology not as an obstacle, as historically has been the case.
Absolutely.
But as a welcome tool that will allow them to do their job better and will, so to say, reignite the joy of taking care of patients. And ultimately, we're striving to make all of that affordable because our task is not just to create a new ecosystem, but to create an ecosystem that is affordable. Affordability is really, really important.
Absolutely. Affordability is important, and so is joy. And I love that you brought that, to the forefront, because that is important to bring that back into the practice and for the patients and their experience.
Absolutely.
So thank you for bringing that up. Well, you're leading an incredible mission on a massive scale, again, during a time of change in healthcare. As we look forward, you're shaping the way you care and the way that you deliver that. What do you think? How do you envision this changing across the entire industry beyond just what you're doing?
Well, we do believe that there is a lot of change that will happen in healthcare in general in the United States, but also globally. And that change is really welcome. So what I'm speaking about is the change that would allow us to provide this excellence in healthcare in a scalable and affordable manner. Right now, we know what the experience with healthcare looks like in pretty much every country around the world. Healthcare is difficult to access. Healthcare creates typically experiences that are not standardized, that vary a lot. The quality is highly, highly variable. Affordability is really not there. So we do believe that a future of healthcare should look like a future of many more mature industries when you have kind of a standards that people get access when it comes to healthcare, that they can rely on a quality of care that they receive, but also that the price of that care is something that everyone should be able to afford.
Absolutely. You're speaking my language when you say affordability and access to care. That's so important for everyone. Well, I wish we had more time to talk, but I just appreciate the time that we had. It's clear that you are leading us into this next era of healthcare, and we're fortunate to be your partner. So thank you so much for being here with us. And after this, we're going to take a quick break, and then we'll be back for more Oracle TV.